Hi, welcome to EMT in 5, where we discuss skills and concepts of the EMT class in 5 minutes or less. This is a great place for you to start. If you're just learning a skill, you can watch this and then start to practice. Or if you've already learned a skill or concept, you can watch this and review to make sure that you've got all the key points and concepts down. Now let's go ahead and get started. Today we're going to be discussing basic airway maneuvers. We use airway maneuvers to keep a patient's airway open when they can't do it themselves. So who are the type of people that are going to need this help? Well, mostly it's folks that have an altered mental status, such as unconsciousness, or maybe that they're in cardiac or respiratory arrest, and we may need to do something to keep their airway open so we can either deliver oxygen or let them breathe on their own there. So there's two types of basic airway maneuvers that we're going to use as EMTs. The first is called the head tilt chin lift maneuver, and the second is the jaw thrust maneuver. We'll go over both of those very quickly. But before we start the skills, we've got to know what kind of equipment and tools that we're going to need to use. The first thing that we're going to need is our tools. What do we need for this? Well, we just need our hands. For this one, simple enough, right? But we're also going to need some equipment to do this as well. And for this, it's pretty basic. All that we're going to need is our PPE. So we're going to need gloves, a mask, and safety goggles. Now you're saying, I know why we need the gloves, but why do we need the rest of it? Well, when we do airway maneuvers, we're going to be pretty close to our patient's face. Maybe not this close, but we're still going to be really close. And so if they cough, spit, vomit, we don't want any of those fluids from their body entering our bodies. Our eyes, nose, and mouth are all doorways into our bodies for viruses and other pathogens like that. So if we wear these, we hopefully close those doors and keep ourselves safe. So let's talk about our first airway maneuver. We're going to be using the head tilt chin lift. This is your patient and they're unconscious. Maybe you hear some snoring sounds, which is a sign of poor airway. So we're going to open it up. First thing that you're going to do, you have to realize is that hopefully our guy doesn't have any trauma to the head, neck, or spine. If your patient has any suspected trauma to the head, neck, or spine, you can't use this because we're going to be moving the neck a bit. So this is for a patient that has no trauma to the head, neck, or spine. Really simple. First thing you do is you're going to take one hand, you're going to place it on the patient's forehead, and you're going to take two fingers and put it underneath the patient's jawbone, right underneath their chin, in the bony part, not the soft fleshy part, but the bony part. You're going to place some pressure down on the forehead to help rotate the head back, and you're going to lift up on the chin. What this does is it's going to move the structures inside the mouth, throat, keep them forward and keep our airway open. What you want to do here is you want to make sure that your bottom teeth of your patient are pretty close to the top teeth there. And you may need to put your thumb in their mouth to pull down their top or the bottom lip rather. And that way you can ensure the airway is open. Now, once you've got the head tilt chin lift in place, you must maintain it. You can't just let it go. This dummy will stay here like this, but a real patient won't. So once you get it, make sure you maintain it. Our second airway maneuver is going to be called the jaw thrust maneuver. Now this is for the patients that do have the head, neck, or a spinal injury, either obvious or suspected. We don't want to move their neck like we did with the head tilt chin lift a little bit. We don't want to make an injury that could be there any worse. So what we're going to do here with the jaw thrust maneuver, our patient that has either suspected or obvious head, neck, or spine trauma, we're going to take our two fingers here, and we're going to place them in the corner of the jaw. So right back here, corner of the jaws. What we're going to do with our thumbs, we're going to place them right about on the cheekbones, and then we're going to kind of press down with our thumbs to anchor our hands there, and then use our two fingers to press forward and up on the jawbone for this patient. So that lifts the jaw forward and up for this patient and takes those structures and keeps them clear in the airway. So that is your jaw thrust maneuver. Thumbs on the cheekbones, two fingers here. You can also use your knuckles there under the corner of the jaw and lift straight up. Now again, just like the head tilt chin lift, once you get this, you have to maintain it. You can't just let it go. It doesn't stay there. So once you get this, you have to maintain it. So there it is, folks, in 5 minutes or less, your basic airway maneuvers, both your head tilt chin lift and your jaw thrust maneuver. Make sure that you watch this again if you need to, and then get practicing. Get good at this. This is an integral skill that we all need to know. See you at the next EMT in 5.